I was very grateful to hear your reference to the 4 hours that residents need in long-term care, because as they transition from hospitals, they very much are much more acute and complex. And so with that in mind, I do wish you well with this legislation. Is there anything we can do to help you with this legislation to get it move forward?
Well, I mean, I think the work that you are already doing to try to educate the new government in terms of the solutions that you see as the ones that will take the, take the system that we have now that's broken and turn it into something that we can be proud of is really, really important work. And I saw the minister leaving. We know that there are some big changes coming for our healthcare system. The government's made some promises around the number of beds, but what I think you and I both need to work on is reminding them it's the quality of care and it's the staffing ratios and it's having RNs there in the facilities to make sure that everything is running the way that it should be. So we need to bump up the investment. And for a government that's talking about 4% cuts across the board, I don't see a lot of talk about investment in healthcare, and it's very, very worrisome.
You're totally right. It's the evidence that's there, and the registered nurses is what brings the difference to the point of care. Thank you very much.
Absolutely, absolutely. And I just also thank you for your question. I just also want to mention that we know that home care is also a system that's broken, and we know the important role that RNs should be playing in making sure that those initial assessments are done by RNs, right? I mean, you're the ones that have the level of experience, knowledge, but also experience to make those assessments and help fix our home care system as well.
Sorry, over there, I have left side neglect, which is not a good sign for the...
I'm Angela DiMarco, and I'm the president of the Ontario Correctional Nurses Interest Group. And I just wanted to thank you for your comments about your commitment to primary care. I wanted to ask you to always remember that we do have a population in custody who are very vulnerable. They're subjected to social determinants of health. And when they transition back into their communities, into the primary care that exists currently, it is far from seamless. There's many different strategies that could address this, but I think that the systemic changes are what we're advocating for, which is the platform of the current, the current RNAO platform. So I just wanted to ask you to please keep that in mind and to prioritize this population, as they are very, certainly very high risk in many different ways. Thank you.
Thank you for the question or the comment, and I certainly agree with you that there needs to be that coordination of care. And I have a detention center or a corrections facility, I guess it's more appropriately called in my riding. I've visited the facility. I've seen the people who are there, who are have serious mental health challenges, are really people that have been living on the streets or homeless, and they've become criminalized. I mean, people with mental health, addictions, homelessness have become criminalized, and they end up in our criminal justice system, and they don't get the kinds of mental health addiction supports that they should be getting. Then they come out, as you said, and it becomes a revolving door because they're not attached to the kind of primary care that they need, as well as the other supports. And so it becomes a vicious cycle, and the average age of people in that corrections facility, the last time I toured it, had increased monumentally, because it's people that that are not able to keep a roof over their head, and they keep transitioning in and out of the corrections facility as a way to survive. And it's it's a very cruel way for people to have to live their lives. And so I agree with you. I agree with you completely. They're a very, very, very vulnerable population, and we shouldn't be criminalizing them. We should be providing them with access to primary care, housing, supportive housing where it's needed, and mental health and addiction supports.
Thank you.
Good afternoon, Ms. Horwath. My name is Lamo. I represent Region 7, Toronto East. I have a question about the Dr. Devlin's report that's being consulted for trying to coordinate smooth healthcare. First of all, I would like to thank you for raising the question about whether the government is looking towards privatizing healthcare, and I was following that news very closely, so thank you for taking that leadership. Second, in a conversation with one of the MPPs, we also came up that the consultation report that came up has not consulted the registered nurses or the RNs. Now, registered nurses being the representing the major portion of the healthcare providers, I don't seem to understand why the RNs are not being consulted on this, because I work in a downtown hospital, and for me, my patient sees the doctors even now and then, and it's only the nurses who are always the communicating link between the patients and the whole system. And so my question is, if the RNs are not involved, how does coordinating smooth healthcare go forward?
No, it's an excellent question. I mean, I think it's important to acknowledge that Mr. Devlin's report, Dr. Devlin's report, was pretty much stated the obvious. I mean, I don't know that there was anything new in that report that people weren't already aware of. Now, I guess there's going to be some follow-up recommendations, but we've seen this already so many times from the new government, is that they tend to do things behind closed doors. They only talk to a select few of their own folks that are going to kind of justify what it is that they're trying to do, and the very people that have been holding our healthcare system together as it's been as it's been crumbling around our ears because of lack of funding and hospital freezes and those kinds of things, you're the people that have the solutions. And the Premier gets up in the legislature and says he wants to talk to frontline workers. Well, if he's not talking to you guys, then I don't know what frontline workers in healthcare he's talking to. But you're absolutely right. I mean, you are in the systems, all of the systems, all of our healthcare systems, whether it's primary care, whether it's hospitals, whether it's long-term care, whether it's home care and community, CHCs. I mean, you're everywhere. So why wouldn't that be one of the biggest priorities, is to get your insights and your perspectives and your solutions, right?
So, thank you.
Absolutely.
Sorry, I'm a bit tall. Hi, my name is Larissa Gadsby. I'm on the board of directors for the RNAO. I'm also the co-chair of the Nurse Practitioners Interest Group. My question is very simple, is can we count on your party as the official opposition to support us as nurse practitioners in removing the barriers to our scope of practice? This is one very key way that you can address the backlog in our healthcare system, is to ensure that not only nurse practitioners are practicing to their full scope, but also that registered nurses continue to have the ability to practice to their full scope so that we can address the system backlogs that we have.
Yeah, no, I guess one word answer, absolutely. We've been pushing, and you'll know that my health critic, France Gelina, who has been the health critic for the NDP for a very long time, has been very active with your organization, and we have been doing that pushing already, and had some success with the former government, but need to continue to push for the broader scope, for the full scope, as well as things like the prescriptions and ordering of tests and those kinds of advancements need to happen. I mean, it's unfathomable that we have a system that's that's so challenged in terms of providing appropriate care. Now, as I said, a lot of that is funding related, but there are also other solutions than funding, and the ones that we're talking about with scope of practice for the work that you do as nurse practitioners is absolutely part of the solution. It's almost a no-brainer. So yes, absolutely, we're with you.
Thank you for your support.
So, thank you, Andrea. And I also need to say, in your new capacity.
Yes.
Absolutely. Official opposition, we are thrilled that we are working with you in that capacity. We are thrilled that you are pushing many of the issues that we are asking. In this issue of the health system restructuring, yes, we have been consulted, I must correct that. And we have said that primary care needs to be the centerpiece of the system. And we will say it, we have been saying it in the past, we will say it now, we will say it in the future. Because any high-performing health system is anchored in primary care. And it's beyond me why that's not happening here in Ontario and in Canada in general, and it's about time, so we may be surprised. And hopefully, if nothing else, we will see a big role for primary care and for upping up scope of every professional, including RNs and NPs. So we know we can count on you. Thank you very, very much. A pleasure.